Welcome back. We're getting into the meat and potatoes here, jumping into the root cause of the dysfunction that's happening in the body right now, which is all in the digestive tract, in the microbiome. My name is Carly Schroeder, functional nutrition coach, your fertility coach, and I'm excited to dive into this topic. It is one of my favorite topics ever, as it is the root of problems and dysfunction in the body. There are so many disturbances, so many things that impact and affect our microbiome. From the food that we eat, to the water that we drink, to the chemicals that we touch, to the medications that we use, all of them do have an impact on the gut biome. So we're going to be talking about that today, and also giving you the overview of what is to come in this next week of study. So without further ado, let's jump into this. Here's what we'll cover in week 2. We are going to explore the critical role that the gut plays in fertility. We're going to cover the gut microbiome, the gut-brain axis, and practical steps to improve gut health to support reproductive health. The objectives here is to understand the relationship between gut and fertility, and to learn about the gut microbiome and its impact on hormonal balance, and to discover dietary and lifestyle changes that support gut health. And also what to do to implement these practical strategies and improve gut health for better fertility outcomes. So in today's video, we're going to be talking about the gut microbiome, the impact on overall health and fertility, some case studies and real life examples, talking a little bit more about gut dysbiosis and what is it, gut health personal assessment, and a discussion prompt to really dive into your own understanding of your own signs and symptoms and what your body is telling you. So if you guys haven't done this already, follow me on YouTube, Roots in Fertility, follow me on Instagram, and follow me on TikTok. Here I have exclusive content that is not necessarily shown in this school community. So share this course with other couples, other people who have issues with their health. All of it can be applied, getting yourself to your optimal state of health, which is going to empower women and also help get the world pregnant. So join me on this journey. Warning, this is the most important video in the entire course. This is the building blocks. We keep building one week after another. So watch the entire video. Don't skip, don't fast forward, just watch it. If you've heard it before, allow the information to seep in and understand it deeper, so this becomes your new knowing. When we go to food and water and all of our lifestyle changes, it comes with a deeper meaning when we fully understand the why. The pro tip for you is, if you have heard this before, you can put this on speed 1 or 2. So let's dive into the gut microbiome. The gut microbiome is a huge host of different viruses and bacteria and protozoa and fungi and archaea. They inhabit the gastrointestinal tract. We want a wide variety in the GI tract. It actually helps that diverse system. It helps fight off viruses. It helps support the immune system. So the composition, we're going to examine the diverse array of microorganisms present in the gut microbiome and discuss their roles in maintaining digestive health, synthesizing essential nutrients, and modulating the immune function. So you guys, our diet is only as good as our digestive tract can even work. If we have sick digestive tract and and it's got like leaky gut, or we have digestion distress, it doesn't matter if you have the best diet in the world if you're not capable of absorbing the nutrition that you're putting in anyways. So this is why it's so important for you to heal the digestive tract, so we can actually absorb the essential nutrients that we need. So the role in digestion and immunity, we're going to explore how the gut microbiome contributes to the breakdown and the absorption of nutrients, as well as its crucial role in regulating the immune responses and protecting against pathogens. So what is the microbiome? We just said it. Can you guys remember it? The microbiome refers to the community of microorganisms that reside in our GI tract. It includes bacteria, viruses, fungi, and archaea. These microbes play a vital role in maintaining our health and well-being. The composition of the microbiome is incredibly diverse with thousands of different species. Each person's gut microbiome is unique and influenced by factors like diet, environment, genetics, also the environment that you live in. We already said that. Diet and genetics. Yes, literally from the time that we are born, how we are born, whether that's a cesarean versus a vaginal birth, that it changes the different organisms that you have been exposed to. What your mother ate while carrying you. And also, what's the environment like that you're living in? Are you exposed to outside elements? Do you have pets? Are you exposed to animals and the different bacteria and viruses that they get? In a world that we have learned to be so clean, we actually are doing a disfavor to our bodies. So dirtier is better. We want to be exposed to all these elements. It helps diversify the microbiome. So maintaining a diverse and balanced gut microbiome is essential for optimal health. So looking here at this chart, just notice how the difference in bacteria here are completely different from Italy to Africa. I noticed this with my family when we moved from Michigan to Hawaii. It took an entire year. We're kind of still going through it, where our digestive tracts are still settling into this moist, warm environment, and the bacteria and funguses and viruses here are completely different than what is over there. So it's taking some time for us to get exposure, and we do that through the different fermented foods that we eat. And I am going to talk to you guys more about that and how to cultivate and really pull in the bacteria from your environment to benefit your health. So the impact on overall health and fertility. When we think of our gut health, I want you to, first I'm going to ask you a question. Where do you think that our digestion actually starts? So if you're looking at this picture here, you may be thinking, here, it starts here, it's in the mouth. But I'm going to ask you another question, or imagination. I want you to think about eating a lemon right now. Think about like it's right here in my hand and you're about to squirt it in your mouth or lick it or suck it. Just think about doing that. What is starting to happen right now? If you have like a good response and this is working accurately, you should start to salivate. So you might be feeling the salivary gland starting to produce saliva. In the saliva, we have amylase. Amylase breaks down our carbohydrates. So where it really starts is in the mind. So bringing mindfulness practices before we eat our food, before we start actually putting the food in our mouth, chomping it up, bringing mindful practices to the mind to help our digestion, to help the secretion of these salivary enzymes that are going to help break down our food. The more we can do practices to break down our food, we take some of the pressure and the strain and the work off the digestive tract. That's why chewing our food is so important, and chewing it thoroughly, keeping the food between our teeth rather than storing it in the back of our cheeks like chipmunks, where we don't fully chew, and so it's harder for the body to digest. So fully chewing, using our teeth, using our tongue for smashing and breaking it down completely before we swallow. This is actually one of the reasons why I also don't suggest drinking water while we eat our food, because we're not using our saliva and the breakdown of our teeth and our tongue, and instead relying on a swoosh of water to help clear our throat, which causes a lot of work in the digestive tract later on. So after we think about our food, we set intentions, we start to feel the release of these enzymes, we're salivating, we are going to chew our food, chewing it, keeping it in the teeth, taking these smaller bites, chewing thoroughly. We swallow, it goes down the esophagus, it goes into the stomach. We have help from our pancreas and our liver and our gallbladder. And guys, if you are eating a high processed diet, or if you're eating a lot of packaged foods, it is usually filled with sugars. And when we have too much sugar in the body, meaning more than 25 grams of sugar, I say zero added sugar, but if you're like, whoa, that's too big of a change, then starting with less than 25 grams, otherwise it's just stressing the liver. Our body isn't able to process it. So the liver is being stressed. And then it will take those extra carbohydrates and store it as fat. So we're wanting to make sure we're eating a balanced diet. It comes through the stomach, then it goes through the small intestine. And the small intestine is just a whirlwind of tubes. And these tubes stretch like as tall as a telephone pole, guys. It's feet and feet long, so it's stretched out. And that's where we're doing our assimilation and absorption for our nutrients and going into the large intestine. And then we finally release the food out of the rectum as poop. And our poop tells us so much about how our body is actually digesting our food. And I have my clients and students all track their poop, track their mood, track when they're eating, so they can start getting an understanding about what they eat, how that impacts their mood, and how that impacts their digestive tract. Are they absorbing the food? We would see that through the stool, whether it's greasy, floaty, different colors, or how it's well formed. A great poop showing me that this digestive tract is working and running great would be not overly odorous, ranging in a brown color, and it actually makes the shape of your colon. So look here. Look at the shape of the large intestine. So a full elimination would have some sort of this shape showing that we had complete elimination, rather than it having been really runny or really like pebbles, like little rabbit poops. So one shows me a food sensitivity, and one shows me that there's not enough fiber and there's not enough hydration. And so we're using this information, the signs and symptoms of our daily body reactions, to get an insight about how well our gut health is actually working. Is it working for us, or does it need some help? So the role in digestion and immunity. The gut microbiome plays a crucial role in digestion, helping break down food and absorb nutrients. It also plays a key role in regulating the immune system and protecting against pathogens. A healthy microbiome is essential for proper digestion and immune function. So if we are not in a place of having a good, strong gut lining, what happens is, if you think about like a plush carpet, right? Like how it's got like these like little finger-like projections. This is what actually will reach out and grab a hold and use and assimilate and absorb the nutrition. Well, over time, when we're eating a poor diet, sticky, gluey foods, glutinous foods, inflammatory foods, it starts to wear down the villi. And we start to see these little gap junctions, like these little gaps in the intestinal lining. So before it being knit together, making sure that the food just goes from the mouth to the anus, now we start to get holes. It gets more permeable, and where food is now passing into the bloodstream, causing an inflammatory response in the body. This can result in like interesting autoimmune diseases like cancers, Hashimoto's. The body is attacking itself. And so the immune system and the gut health is so closely tied into our health. So we're going to talk a little bit about dysbiosis and how and what is dysbiosis, the impact on the microbiome that leads to that inflammation and contributes to different health conditions. So it could be the autoimmune diseases, it could be metabolic disorders, and even mental health issues. So by maintaining that healthy microbiome, we reduce the risk of these conditions. So gut health is intricately linked to fertility, affecting hormonal balance and reproductive function. Imbalances in the microbiome can disrupt fertility and increase reproductive issues, and optimizing gut health may improve fertility outcomes and support reproductive health. So I'm going to get into more on gut dysbiosis and signs and symptoms of that, but I want to look at a case study so you guys can start to feel and connect how other people have healed the microbiome and its impact on their fertility journey. So these stories are highlighting the potential for lifestyle interventions and improve reproductive health. By learning these examples, we can better understand the importance of gut health and fertility. So here, talking about Sarah, she's a 32-year-old woman who's been trying to conceive with her partner for over a year without success. So despite their efforts, she's unable to get pregnant and starting to feel frustrated and discouraged. So after consulting with a specialist, Sarah learns that she may have an underlying issue with her gut that could be affecting her fertility. She undergoes tests, assess the health of her gut, and discovers that she has an imbalance in the beneficial bacteria, along with increased levels of inflammation. So the imbalance of the beneficial bacteria would result in, how do you know that's happening? Is you're like, oh, I catch every cold, or I'm not always feeling my best, I'm lethargic, I have skin issues, acne. It's any signs, even weird rashes in the body. These are signs of inflammation. It could be in the joints, it could be in the body, it could be in the gut, it could be in the brain where you're not happy or frustrated or frazzled or anxious or depressed. All of these are telling you that there could be some dysfunction in the gut, and it's leading to inflammation in the body. So with the guidance of a healthcare provider, Sarah develops a gut-friendly, fiber-rich diet with prebiotics, probiotics to restore the balance in the microbiome. She focuses on consuming whole foods such as fruits and vegetables, lean proteins, and fermented foods like yogurt and kefir. So all of these things, a diet rich in fiber is going to help correct the dysbiosis. It's going to help add bulk to the stools. So that's what the fiber does. It's the husky stuff that helps move the poo a long way. And when we increase fiber, we don't just all of a sudden start eating a bunch of fiber bars. We have to do this slowly and in a progressive way, start low and go slow. And with it, we need to be drinking water along the way. So if we're increasing fiber, we're increasing water. A good cue for me to take a sip. So prebiotics and probiotics. Prebiotics in the food that we're eating, thinking bananas, using our food as our medicine, and probiotics as well, and using those fermented foods to bring it in. If you are using a probiotic, there is a time and place for it, but it is not the end-all be-all. When we look at these solutions, these medications or pills or quick fixes, it gives you a bit of help in the right direction. And that's my advice on probiotics. We'll talk more about it further along. But it's using the food also as our medicine to support the microbiome. So over the following months, Sarah notices she gets significant improvements in her digestive health, reducing bloating and discomfort, but more importantly, she experiences her menstrual cycle and ovulation patterns change, indicating an improvement in the hormonal balance. I have seen this work from time to time with clients. As soon as they start filling their body with quality food, the menstrual cycle literally changes. I have seen women go from anovulatory cycles, which we talked about in last week's section, to having consistent and regular ovulation months. I have seen people with estrogen dominance start to regulate the hormone levels between estrogen and progesterone, and you could see that in the charts. We could see it with their basal body temperatures. I have seen blood sugar issues go completely away. I have seen people who are pre-diabetic and diabetic completely off of medication or never go on insulin and fix this, all by diving into gut health and using the food as medicine to support them. So after 6 months of prioritizing her gut health and making lifestyle modifications, Sarah receives the news she's been looking for. She is pregnant, and she credits her dedication to improving her gut health. and helping achieve the dream of starting her family. So Sarah's story highlights the powerful connection between gut health and fertility by addressing underlying gut issues and promoting a healthy gut microbiome. Individuals like Sarah can enhance their chances of conceiving and getting pregnant. So I want to show you this video about Christine. She is going to just talk about the impact of taking a step back instead of jumping into these really expensive procedures with IVF. We're going to just start to take that back seat and figure out what's actually going on that is causing the issue. Let me make this a little bigger here. Let's see.
Going through IVF is tough. It can be physically and emotionally challenging. And even though getting pregnant can make it all worth it in the end, there can be other impacts to your health along the way. Just ask Christine, a Tiny Health customer who started to experience some health issues after her first round of IVF. She was feeling bloated, felt like her digestion was slowing, and she even started to experience reactions to certain foods. She also noticed a change in her vaginal smell and had vaginal irritation.
I'm going to pause here. So bloated, a sign of gut dysbiosis, right? Slow digestion, meaning you're not completely eliminating or eliminating often. A couple different factors that come in with our digestive tract and timing is the contents of our food. So highly fatty versus high in protein or carbs, and what's the quality of each of those macros. The reactions to food, this shows that there is a chemical or a food sensitivity. And so in eliminating highly inflammatory foods, we can heal and not have these reactions to the food sensitivities. But this occurs over time as we're exposed to these different toxins and pollutants in the body. And when we don't have enough of that good bacteria in the microbiome. And the vaginal smell and irritation, this is coming down to how the microbiome is actually very important for regulating our pH of our body. And so we're going to get into this a little bit more. So looking at the underlying cause and healing that.
She had not had before. While these vaginal symptoms are common with hormonal changes like IVF or pregnancy, Christine felt a little concerned, so she decided to take a break from IVF to take care of herself first. And part of that self-care included a Tiny Health vaginal microbiome test. When she got her results back, she was more than surprised. The test showed that her vaginal community state type was similar to those associated with infertility and increased risk of preterm birth. She had high levels of unfriendly bacteria and extremely low levels of lactobacillus, which typically dominate a healthy vaginal microbiome. So she took a probiotic with the specific strains of lactobacillus recommended in her action plan and was actually able to successfully shift her vaginal microbiome. You can see it's dominated by Lactobacillus gasseri now. This type has a protective effect that lowers pH and is associated with a lower risk for preterm delivery during pregnancy. Christine returned to her IVF journey, and great news, she is now pregnant and expecting a little girl.
So what I appreciate about this study here is that we are looking at underlying causes or the root cause for the dysfunction in the body. And you can see in taking those steps back sometimes and zooming out and listening to the messages from the body to figure out where is the dysfunction and how can I actually start to correct that from the deeper side, from the inside out. When we do that, we actually help have a more healthy pregnancy. So not only your body in a way is protecting yourself from carrying this baby, in order to keep you alive. And so let's look at the signs and symptoms and let's dive deeper and find that root cause resolution. So without further ado, we're going to dive into what is gut dysbiosis, this big old word, and how do you know if you have it? So here are some of the symptoms. Digestive issues, this can be bloating, gas, diarrhea, constipation, abnormal abdominal pain, and indigestion. If you're burping a lot, guess what? That shows me there's not enough stomach acid in the body to break down the food. If you are swinging between having constipation and diarrhea, guess what? This is just actually constipation masked as diarrhea. It's not actually a different thing, it's the same thing. If you have a lot of bloating and gas, this is an abdominal pain. All this tells me that you are having a reaction to some sort of food and your body is producing too much gas. So it's causing a problem in your digestive tract. Mental health. So the gut is tied to the brain. That's the gut-brain axis. So if you struggle with anxiety and depression and mood swings and brain fog, not having that clear thought, it is reflective of having gut dysbiosis. Skin conditions, including acne, eczema, rosacea, and psoriasis. All of these are actually just your body trying to eliminate toxins from the body. I have had clients where as soon as they start to clean up their diet and taking out inflammatory foods and taking out foods that their body is having a reaction to, they've completely come off of acne medication that was actually an antibiotic that the doctors would keep cycling them for years on different acne medication, which was causing worse and worse gut dysbiosis. So if you are taking medication thinking that you're fixing a problem, you may actually be making that problem worse. Now, 3 months later, I have had clients completely come off of those medications as step one, fix their gut, fix their eating, do all the things to help rehab the microbiome, eliminate toxins from their body, and now they can go out without wearing anything on their face, without feeling insecure about, oh my gosh, all these acne scars and looks like this. And they feel clear and confident, and it's actually healing from the gut out. So skin issues are definitely a result of this gut dysbiosis. The immune system, so having frequent infections, if you feel like you get sick anytime somebody's around you, this is a sign. Allergies, autoimmune conditions. So these things aren't just by chance. The root is in the stomach. Metabolic issues. So if you're having unexplained gain or loss, or you have the inability to lose weight when you're trying, then this is a symptom of gut dysbiosis in addition to having blood sugar imbalances. So if we're having these swings, or if we are on the pre-diabetic curve, you're going to see that through your labs. Nutritional deficiencies, so fatigue, weakness, anemia, and vitamin and mineral deficiencies. You can see this in your skin, in your hair, and your nails. General well-being, so having chronic fatigue or sleep disturbances, headaches, and joint pain. More causes. So here is our cause, poor diet. Did you think I was going to go there? So the consumption of processed foods, high in sugar, low in fiber, and I would even include high in fat. A lot of the food that you're eating is probably high in the combination of sugar and fat. And if it's coming from unhealthy sources of fat, such as our seed oils like canola oil, I can't believe it's not butter. It's not butter. We're eating these foods that are highly processed and highly inflammatory. And it's really common in any of the products that you'll see on the shelves or in boxes in the stores. This is why it's important to shop the perimeter, shop the cold section. So it disrupts the balance of the gut bacteria, promoting harmful bacteria over beneficial ones. The next one is antibiotic use. So using frequent or prolonged use of antibiotics. It kills both the harmful and the beneficial bacteria, leading to reduced microbial diversity. When we think about antibiotics, you might not even realize that your acne medication is an antibiotic. You may not notice that a topical cream is an antibiotic. You may go into the doctor and have a viral infection, and the doctors will actually prescribe you an antibiotic just in case. An antibiotic will do nothing for a viral infection. A viral infection needs to run its course. That's how they work. It is not a use for antibiotics. And when we take them, and we consistently take them, we end up completely wiping out the microbiome that has both the good and the bad bacteria in there. If we were to do something, even having the thought, okay, well, after I took my antibiotic, I started taking a probiotic. I want you to think about filling up a bathtub full of water, okay? And the bathtub's full to the top. When we take an antibiotic, imagine this culture, like billions of different species and varieties that we have cultivated in your lifetime. We wipe it out. We drain the entire tub. And then imagine draining that whole tub and being done with that antibiotic and then plugging it again and taking an antibiotic daily. Guess what that would be comparable to? Taking 1 cup of water and dumping it in the tub. It doesn't have the diversity. It doesn't have the variety that we need for a thriving microbiome. So that's why it's so important to avoid, as much as you can, antibiotic use, unless it's really severe. In addition, there has been a study on antibiotics that was when most children from when they're born up until 18 will have had at least 17 doses or exposures to antibiotics. And this is incredibly sad to me, because when we're in that state, knowing how it's closely linked to the immune system, it just decreases our ability to fight off these viruses. And it puts us in a highly state of being really chronically sick. So chronic stress is the next one. So persistent and psychological or physical stress can actually alter the gut motility and permeability, impacting the bacterial composition and growth. If you're a human in 2024 and beyond, that's when this course is created, and you're living in the fast-paced world and you're using your phone or you're distracting yourself, you're not taking separate time to create space, to chill out, to enjoy stop and smell the roses, and just to turn off all the bells and notifications and expectations, then you're likely in this state of chronic stress. And in this state of chronic stress, as you learned from week 1, we are not in a place to digest our food. That's one of the main issues here. And we're not in a place to create life. Our reproductive organs, we literally will push back ovulation, or you'll have anovulation, like we talked about in week 1. So chronic stress does impact the stomach and how we absorb our nutrition and lead to dysbiosis. Lack of sleep, inadequate or poor sleep, can actually disrupt the circadian rhythm, which negatively affects the gut microbiome balance. When we're in sleep, our body actually has a chance to detoxify. We have a chance for the creation of new cells and also the destruction of old and bad. And this happens when we're not digesting. In the daytime, when we're awake, our body is strictly digesting. We're not regenerating. We're not helping improve our health. So that's why sleep is so important, to get in this deep, restful sleep. Sedentary lifestyle, such as lack of physical activity, reduces the diversity and abundance of beneficial gut bacteria. And environmental exposures such as pollutants, chemicals, or heavy metals leads to imbalances in the gut flora and promote growth of pathogenic bacteria. Infections. So gastrointestinal infections caused by bacteria, viruses, and parasites. It directly disrupts the gut microbial balance and can lead to long-term changes in the microbiome. So if you guys have ever had an experience by having a bacterial infection or viruses or parasites will literally change your cravings. It will mess with your mind. It will change how you feel, making you feel more anxious. When any of these things become out of balance and our microbiome becomes the optimal our ideal host for parasites and viruses, that environment is thriving, and our beneficial bacteria is dying. It's not healthy for it at all. So we have this imbalance, and it will give you a whole host of issues. So aging, it's a natural aging process. It alters the gut microbiome composition and reduces the beneficial bacteria. And so we want to age well. We want to make sure that we're eating food that's going to support the microbiome. We're going to make sure that we're eating collagen. We're making sure that we're eating foods that's going to help repair the gut lining. Hormonal changes. So changes due to pregnancy or menopause or hormonal therapies can impact the gut permeability and microbial composition. Poor dental hygiene. Oral bacteria can imbalance, leading to swallowing of harmful bacteria, and it can introduce harmful bacteria in the gut, impacting its microbial balance. So think about this. Even you'll have an idea as how often you get cavities. If we don't have the correct pH of our saliva, it can contribute to more decay in the teeth. Dietary changes, so having rapid changes in the diet, such as switching to high fat, high protein, low fat, ketogenic, 1200 calorie diets, just constantly changing alters the gut microbiome and sometimes reduces the microbial diversity. And alcohol consumption, so excessive intake of alcohol negatively impacts the gut lining and the balance, promoting gut health of harmful bacteria. Smoking, using tobacco, and even marijuana impacts the gut health by altering the microbial composition and increasing harmful bacteria. Medical conditions like diabetes, obesity, and autoimmune can impact the microbiota. And what's interesting about this is I see arrows going both ways in this, as one of having dysbiosis can lead to these conditions such as diabetes and obesity, but also when you have these conditions, how it can alter the gut microbiota. It goes both ways, the chicken or the egg. Antibiotics, we talked about this, so frequent or prolonged use of antibiotics kills both the harmful and beneficial. PPIs and antacids, this proton pump inhibitors and antacids from acidic reflux and heartburn. It actually reduces stomach acid, which can lead to bacterial overgrowth in the stomach and the intestines. So when I mentioned to you guys having acid reflux, having burping, this actually tells me there's not enough stomach acid in the body. And this is when I would say increase your stomach acid, drink your apple cider vinegar, have your lemon water, take hydrochloric acid, these things that actually can help repair and increase the stomach acid over time, which you think is the opposite, but these antacids are stripping the stomach lining from this really important acid that helps break down our food. And NSAIDs, so these are non-steroidal anti-inflammatory drugs that are used for pain relief. So think about your Advil or Tylenol. I have had so many women who have had or struggled with PMS symptoms, and the only way they could get through their menstrual cycle because of the intense symptoms was by taking some type of pain relief. And doing that for 10, 14, 20 years is going to actually damage the gut lining. So it increases the gut permeability. So now these foods isn't going from the mouth to the anus, it's actually leaking out into the body, causing inflammation in the entire body. So birth control pills and hormones. So hormonal contraceptives and hormone replacement therapy actually alters hormone levels and can impact the gut permeability and microbial composition as well. It is so normal for young girls at the age of 14 or 15 to just get on the pill, or now they're doing different things where they inject it into your skin. It actually isn't allowing your body to go through a whole cycle. It's a false period. It's not even allowing your body to regulate the hormones, and that will impact the microbiome. Steroids. So anti-inflammatory steroids used for various medical conditions actually suppresses the immune system, which can alter the gut microbiota. Chemotherapy, cancer treatments that target rapidly diving into the cells, it actually harms the intestinal cells and disrupts the gut microbiome, leading to a decrease in the bacterial diversity. Really important when we're looking at the microbiome, is having that diverse field of bacteria that's helpful. Artificial sweeteners, sugar substitutes found in many diet foods and beverages. So you think that you're doing a good thing by not having sugar, thinking, oh, okay, I'm having a sweet and low, or even stevia, it's 0-calorie sweetener, erythritol. They actually can negatively impact the gut bacteria, promoting the growth of harmful microbes. So diets that have too much sugar and fat, the high intake of sugary and fatty foods actually promotes the growth of the harmful bacteria and reduces the beneficial ones. So remember, I was talking, we're feeding these systems, we're feeding the bacteria, and then we all start experiencing different cravings and they take over. The bad one takes over, the good one can't thrive anymore. We have to keep it so we have more of the good guys and less of the bad. So eating more things that are like fermented foods, our kimchis, our yogurts, our kefir, anything that's fermented, I'm all in for it. Not enough fiber, so low consumption of fruits, vegetables, and whole grains. It reduces the food beneficial for bacteria. So they literally feed off of these foods, and that fiber comes in and helps with elimination. So here is a gut health personal assessment that I want to take you guys through. And oops, I'm going to back up here. And if you have, why don't you just do this with me? So you're going to go to https://bit.ly/gut health worksheet. And I want to go through some of these questions with you guys. It's going to help me get to know a little bit more about you and you to actually reflect back on some of these things we just discussed. Do you have a healthy microbiome? Are you doing the correct things right now to support your gut health? And if so, then where can we just take just a tiny step forward? Where can we change something just a little bit and see how that impacts the gut health even more? If you're new to this and you're like, Carly, I could do 150 things to support my gut biome because I am on a routine of antibiotics. I just got off of one. I take Advil consistently for my PMS symptoms or my headaches. I have low energy. I am crabby. I have body aches and pains. Then you're going to start to be like, wow, there's a lot of areas for improvement. So what are we going to do that one step to move the needle forward? Okay. So it's going to encourage some discussion, some critical thinking. And so I want you to take time to actually write down some of the answers in the space provided. So by downloading this sheet, pulling it up with me, you can first look at it. Maybe you end up putting in your community conversation, something that you're going to work on this week, and we can just cheer you on and hold you accountable. So what is gut dysbiosis and what causes it? Can you guys answer this at this point in time? List 3 symptoms of gut dysbiosis. I just listed some for you. And then a personal reflection on some of these symptoms. Have you ever experienced any of these digestive issues, such as bloating, diarrhea, or constipation? If so, describe it. Do you know exactly what you ate? Like, I can tell you within minutes if something had an inflammatory food for my body. I will say, I'll go to the person who ate it, what was in that? Because I can feel it. So when you really get dialed in with your body and you have an understanding, you're going to really be tackling and understanding your own health on such a deep level. Besides digestive issues, have you noticed health problems such as skin, fatigue issues, mood, anything like that, where you could tie in some relevance and make this personal to you? And let's now identify some potential causes. So reflect on your diet. Do you consume foods that are processed, meaning it's coming from a package, it's in a box? Do you eat foods with sugar in it? So processed sugar is coming from beets And it's so heavy, processed and heated and then bleached. Most of our Pioneer white sugar is bleached sugar and highly inflammatory. It literally feeds all of those bad bacteria I talked to you guys about, the parasites and the fungi that cause a lot of issues in the GI tract. Antibiotics. When is the last time you've taken an antibiotic? And what did you do after your antibiotic to help diversify and build up your microbiome? So describe your eating habits. How would you rate your stress levels on a scale of 1 to 10? And do you think that stress could actually be impacting your gut health? For me, this is an area of I'm constantly working on, is putting myself in a place of relaxation when I eat. And in doing that, putting myself in a place of relaxation before I eat, I actually slow down and I chew my food. So it's really interesting to think about, because prior to, I've always been a really busy body, like multitasking, hands in every pot. And now having 3 young children, 3, 4, and under, I'm constantly like picking them up and doing all the things and feeding them. And so like I'm actually in this state of stress. And so like I'm not even actually absorbing the food that I'm eating, the good fuel that I'm eating. So taking those breaths, relaxing, and knowing that like this is such an imperative step in my digestive process of like making it more relaxing, not being stressed around food. And in a culture that puts so much emphasis on dieting, a lot of people are really stressed around the conversation of food. Maybe even talking about it here and now triggers you in your way. You're like, I don't do that, I don't eat that. And it gets to be defensive. So in a culture where we're expected to look a certain way and perform a certain way, and this is good and this is bad, maybe even talking about it stresses you out a little bit. I invite you to just dive into that. Have you noticed any connections between your gut health and other health issues, such as autoimmune diseases, mental health conditions, or heart disease? Now I want you to evaluate the impact of pharmaceuticals. So have you taken any antibiotics recently? If so, did you notice a difference in your immune system? Did you notice afterwards you ended up getting more viruses or sick, or you maybe have been on that train for the last bit of time as we're just coming off of the wintry months where we're all locked up inside and eating all these treats and stuff? What steps can you take to restore that healthy microbiome after using these antibiotics? And now taking action. What changes can you make to your diet to improve your gut health? What steps can you do to manage your stress? And how can you incorporate physical activity in routine? And here's a personal goal. Set one short-term goal for your gut health in the next month, and set one long-term goal to maintain a healthy microbiome. And I have to ask you for reflection, why is it important for you to maintain a healthy microbiome? And how do you think by improving this, it's going to affect your quality of life? So I invite you to drop anything that you feel comfortable sharing in the chat, so we can just open up a discussion and be vulnerable and be honest with each other and ourselves, honestly. It's about being really vulnerable with ourselves about our own health. Once I can own up to it and say, yeah, I'm really not good at this. I mean, I would tell people very often as a personal trainer, and being in the field, I totally misused food. I totally had an emotional addiction eating problem, you know? I'd be at the gym working out, like eating celery and running around doing fitness classes and drinking green juices and all the things. And I'd get home after a long day of doing that, 14 hours. I was tired, and I'd come home and smash some ice cream and eat some cookies with it and mix it all in, and thinking that like doing that was okay, that I was out exercising a bad diet. But the truth is, you can't do that. You can't out exercise a bad diet. I've worked with hundreds of different trainers. We've all had issues around food, even the ones that we think we have it together because we're a health coach. We don't. We're all dealing with the same pressures, because as a child, we learn that food is comfort. And so addressing that, like, yes, I definitely use food as comfort. Okay. Thank you for saying it. And now, how can we move forward? What are the steps? What are the steps? In my next course, not this one, the entire next course called Root Cause Revolution, I actually get into the traumas, the triggers, and the stressors of why we eat, the impact of it on our body, the psychological meaning behind it, and how to break the cycle. So there's going to be more incredible content coming to you guys, more than just calories in, calories out, and all these other things, but the deeper psychological meanings, which I'm so stoked about. So, further exploration, let's explore additional resources to deepen into the understanding of gut health and fertility, engage in discussions and share experiences in the community forum, and together support each other on the journey to get better health. This is a time where we go, oh my gosh, me too. For me, every time I'm a little overtired, I start craving sweets. And I think that that's my way to just give me that spike for a little bit, but it ends up in a bigger crash. So knowing that now, I take the step, I go, oh my gosh, I'm craving sweets. And I go, Carly, are you tired? And I'm like, I am tired. And I'm like, why don't I just give myself the appropriate rest? So I go take 5 minutes if I need to. Put some nice relaxing meditation on and just close my eyes. Fully allow my body to rest, knowing it's just going to be for 5 minutes. I'm going to just relax, fully relax. And when I open my eyes, I'm going to be ready. These different tips I actually provide for you guys with different hypnosises, different body scans, different all of this in the upcoming courses, so you have access to these additional materials and tools that you can actually take away and use. So are there questions? If you have them, please post them in the board. Ask, what are the connections with gut health? What do you do? Anything that comes up for you, ask them in the chat. Save them for the Q&As, the live Q&As, where we're going to have them weekly, and you can jump on, send it to me beforehand, and I can talk about it then, or you just jump on the live call and take some time to address any of the questions that you have. So coming up next, we are going to be diving even further into the gut and its hormonal balance, and like how these two interplay, and what we're going to do as we continue to dive into our understanding and the unraveling of these systems. You're just having a deeper understanding, so you have the bigger why. The bigger why is fertility, the bigger why is ideal health, the bigger why of vitality, and that dream of this life with your family, your expanding and growing family, to actually enter into this reality once we address these deeper causes that maybe nobody has taken the time to dive in with you. So if you guys aren't already doing this, follow me on YouTube, Roots in Fertility, where you're going to get more bits and pieces of my information that I send out to you guys out of love, out of service. And I am so grateful for you tuning in, and we'll check back in with the next video.